Hi everyone on Facebook. Good evening and how are you doing? I want to believe your day has been great. As mine has been awesome too. And I really want to thank God for the gift of life. Because that is the best thing. We can be grateful to God for the gift of life, the gift of existence, the gift of this air we breathe in. It is only the living that can say, okay, I want to plan this, I want to have a baby, I want to do this, I want to do that, I want to plan my future. The dead don't have plans. The dead can't think of, even the ones that have children, that have babies, they leave them behind and they are no more. But in as much as you have this gift of life, it's something I know that you have to be grateful to God for, because once you have life, it shows that there is hope for you. Once there's life, there is hope for you. And I want you to really thank God for that gift, that special gift of life. So I want to welcome you once again tonight to this live session. Okay, I think I have enough lights. Okay, I want to welcome you on YouTube too. If you are joining me, whether on Facebook or on YouTube, just say hi, so that we know that you are here with me. Okay. Oh. All right. Okay, I'm back. Yeah. Okay. Permit me to have a word of prayer tonight before we commence. Father, we thank you, Lord, for tonight. We bless your name. We give you glory because you're a faithful God. Thank you for the gift of life. We are always grateful for this gift you've given to us, because it shows that you are still mindful of us. It shows that you still have plans for us. It shows that you have not forgotten us, and your promises concerning our lives will surely come to pass. We give you all glory in the name of Jesus. We pray, Lord, that tonight, Lord, you speak through me and you give the word that each person needs per time, what they need to do per time, that insight that they need to do that will make them to be a mother, to be a father. Father, release that word for them tonight in the name of Jesus. Your only name be glorified at the end of this. In Jesus' name. Amen. All right. So, once again, I want to welcome you on my book review tonight. Oh, my book is not here. Oh, wow. Please, 1 minute. Let me just go get the book. Thank you. I'm back. All right. Okay, so this is what I've been doing for the past. This is for the past 9 weeks. Yes, it's been 9 weeks that I've started this book review, and wow, it's been an awesome journey so far, so good, and I'm so grateful to God for it. And if one way or the other, this book review, what I've been sharing has really blessed you, just drop it in the comment section and let me just know that this has really blessed you. In case you miss any of this, you can just go to my YouTube channel, actually just come here, or you go to my Instagram page at Couples Waiting Room. Yes, that's my fertility support group on Instagram. Just go check it there, and you can just watch the replay. So today I'm going to start on understanding infertility in women. We talked about infertility in men last week, so we started infertility in women, and I know there are a lot of women that really want to really learn this, but I will indulge our men to also learn things about infertility. Don't say it is women's thing. Infertility is not gender based. It could be the male or the female that's having the challenge. So please, I will advise both husband and wife to go for check to really understand what is going on with their body. So you can just go check that from my page. Okay. All right. So before we go on, as usual, I always have some fertility boosters which are in my book here. and I'll just read some. So the first one here is take some time for yourself and make sure that you focus on winding down at the end of every day. Allow yourself half an hour every evening to relax your body and mind, whether that take a bath, reading a good book, or exercise. When the mind is settled, it helps you to process yourself, because the brain is very important in fertility. The brain is one of the key, is like the engine room for fertility, because it's the one that sends some signal, is one that sends some, so it releases some hormones that enhances fertility. So when your mind is unsettled, when your brain is not really, is distorted, as you are worried about things, when the mind is not settled, it affects the brain and it affects every part of your body. So once this is not settled, it could affect conception from taking place. So please take time to focus, to wind down at the end of every day. Take time, ease yourself up. As a female, as a woman, our body is very complex. I could be biased here because I'm a woman myself. So I know we women, we are very delicate being, and the way God created us, He created us with very special care, such that we need to really take extra time to take care of our body. Yes, because our body is the one that, it's the male that I was talking about it last week, that for every child we birth, our husband has been the one carrying that child, that seed, for a very long time. They've carried the seed in their loins for a very long time, and during fertilization, they now transfer that seed they've been carrying. They transfer it to us, the wives, so that we can consider, so that we can now, we create, we have that God has given us that body, that should I call it a factory where the production takes place. You carrying the sperm for years cannot just bring a baby, but you need another body, you need another compartment where some processes can take place, which is why you need a woman in your life. So being a man alone can't make a baby, so you need a woman. So God has created us, specially given us that womb. That's why they call us, like we say, that's why they call us womb man. That is, we are a man with a womb. That womb makes us special. So as a woman, that womb has made you special. When you look at the structure of a woman, you see that it's very, very delicate. I'm going to just have a pictorial as the structure of how the womb looks like, and how fertilization takes place in our body. So you need to really take care of that body, take care of your mind, as it ease up stress, because these are the things that could affect fertility. So if it's just to go for a spa, just go to somewhere maybe that has nature, somewhere that could make you relax. Maybe you need to just visit someone, just go to cinema, watch movie, as in read a good book, exercise, listen to good music, listen to messages. That's what I've been doing. I don't know, maybe any one of you have heard my declaration I've been making every Monday morning, declaration for fertility. These are the things that you need to really equip yourself with. Things you hear, things you see, these are the things that will determine what you think about. And once you feed yourself, once you feed your mind with positive things, this affects your general well-being. So take time for yourself, take care of yourself, take care of your body, eat good food, eat healthy food. I've been hammering on this: healthy food, healthy lifestyle. Your lifestyle matters. Exercise, mild exercise. So that's the first one. Then the second one: men and women are advised to avoid tight clothes, as it could damage the sperm cells in men, and vaginal environment discovered in vaginal environment. I talked about that last week, that men should avoid. Even men and women, this environment, the private area needs to be very hairy, because it needs that breeze that enhances hair to flow in naturally, so that there's no heat. The heat can affect sperm cell, it can damage sperm cell. So we are encouraged that we should let hair flow through, breeze flow through our private area. Is they don't wear very tight on this, don't wear tight boxer or tight panties. So wear something very hairy. So this enhances conception. It gives the P area a very conducive environment for fertilization to take place. So go to the doctors. It's a good idea to book an appointment with your doctor to have a genital urinary checkup when you decide to try for a baby. So this will be able to rule out any major factors affecting fertility, like sexually transmitted diseases which show no symptoms, and flag up any other potential problems. So it's always important for you to go for checkup. Both of you, both male and female, go for checkup. It's very, very important. Okay, so let's go. Understanding infertility in women. This is very interesting because I love it so much, because it's what I experienced, and I got to understand even more about what went through my body when I was waiting. There's some things that I never understood then that I got to understand now as I do more research on this infertility. Then I was naive. I wasn't experienced. I was not as informed. I was not informed. I didn't even know much about what was happening. Just okay, I was trying for babies then, and it wasn't coming forth. But now that I know, I want you people that maybe you are going through that waiting period, or you are still single lady, you are still a single lady. These are the things that you need to take cognizance of so that you can prepare yourself. Like I said in my video, that it's better for you. There are some things you can prevent rather than looking for the cure later in the future. So these are the things that will help you. If I had known earlier, there are some things that if I had known earlier, perhaps it would have helped me, or I would have known better way to approach it. So it's very important. So understanding infertility in women. Fertility for women relies mostly on ovaries releasing healthy eggs. The reproductive tract must allow an egg to pass into the fallopian tubes and join with the sperm for fertilization. The fertilized egg must travel to the uterus and implant securely in the uterine lining. All these processes must occur for pregnancy to be indicated. Before you can say okay, you are not fertile. Before you can say that okay, I'm infertile, you must have passed through these three major tests. Number one thing is you must have unprotected sex with your partner. Unprotected sex. You can't be saying okay, you want your partner to use protection before being intimate with you. No, you must have unprotected sex with your partner. That's the first thing you must consider. Have unprotected sex with your partner. Then you must be meeting with your partner at least 3 times in a week. Yes, 3 times in a week. If you are trying for babies, I know there might be times that okay, you are tired. There might be times that okay, you are busy, or there might be times that maybe either of you travel or you are not around. But once you are trying for a baby and you are staying around, I don't want to use the word have sex. Make love with your partner at least 3 times in a week. Yes, make love with your partner. So that I've talked about that earlier on when I was discussing about how to build a positive mental health while waiting. Or I think yes, roles of partner of each partner while waiting. So having baby is beyond just getting intimate with your partner. You need to get to a level whereby you don't just see making babies as okay, let's just have sex, and once you are done you just get out of it. You need to make love with your partner. You need to enjoy it. So don't make it look like oh, I'm just trying to endure. Okay, just come and do what you want to do and go. At least all the one you've been doing, we've not seen any result. No, by the time you understand that sex is beyond just your partner coming into you and coming out, then you will see it as something that is enjoyable and not something that you need to endure. When you see sex as something that you are enduring, then it looks like you are it looks like you are being sorry, somebody is distracting me on YouTube with the response there. So it makes it look like okay, you are just trying to let's just do it so that we just have the baby. once you see that, okay, it's something that you enjoy, then even if your partner comes to you every day, you won't see it as if it is duty, because number one, you have met the requirement of, okay, you are with somebody that you love, you're with somebody that you've decided that, okay, I want this person to be the father of my children, I want this person to be the mother of my children, I love this person and I want to get intimate with the person. So when the person even asks for it, it's not, I've talked about this, you can just check some of my videos, I've talked about it. Okay, you want to be intimate with your partner, and your partner is not really in the mood. Why is she not in the mood? Why is he not in the mood? What are the things that are happening? There are so many things that could get someone worried. There are so many things that could get either of the spouses disturbed or worried. But you as a person, whether the male or the female, you should be able to come to a point whereby you really understand what your partner is going through. And I believe that sex is one of the ways that makes us, it's one of the things that gets someone, out of a kind of, it takes you to a realm whereby you forget some things you are going through. It takes you to a realm whereby you forget, the hormones that are released during sex making, during sex, love making, during sex, there are hormones that makes you forget. It takes you to a realm of that excitement, that ecstasy that makes you feel like, oh, you're on top of the world. Okay, there's no problem. You don't even have any problem. So once you understand this, it helps you to. It creates that connection between you and your partner. So once there's connection between the two of you, you begin to long for each other. You begin to desire to be around each other. You don't see sex as something that is punishment. So always understand your partner beyond sex making. If your partner is not into you, then you can't enjoy the sex yourself as a man or as a woman. If your partner, if you are trying to, maybe you see it that you are forcing it on the person, and doctor have said we should be making love, we should be having sex 3 times a week, you have to agree to, even if it can be more than that. It depends on the connection between the two of you. It can be more. There is not too much of sex. There's not too much of having sex. It should be something that both of you would enjoy. So active sex 3 times minimum a week, unprotected sex for at least 1 year. Let me go back again. Active sex at least 3 times a week, unprotected sex, and having this for at least a year. Once you have done this successfully for a year and nothing is coming forth, then that's when you can now say, okay, for that time, you can be saying, okay, you are infertile. Then you might be considering some solutions or what to do. But you've not really tried. Maybe you waited for like 6 months, 7 months. Like I told you that I wasn't aware of all this while I was waiting. But I think when we waited for like 6 or 7 months, that was where we started getting worried that, okay, what is happening? Okay, we started going for checkup to go see doctor and say, okay, what is actually happening? We were doing series of tests. So it was after a year, because I waited for almost 2 years before I had my baby. So before then, we've been doing series of tests, and because we've passed that test, okay, even though it wasn't 3 times a week, but at least we were having active unprotected sex for almost 7 months then. So these are the things that will make you know that, okay, you are infertile. So I want to draw something briefly so that you can just understand how fertility takes place in a woman. I don't know, maybe I can. Okay, let me just try to bring this like this so that people on YouTube can see what I'm drawing here. Okay. Okay. I mentioned the woman body as a house. As a house for babies. Don't mind my drawing. Okay, so assuming this represents as a picture of the woman uh, uh, womb, the reproductive part of the woman, and this is the reproductive. So this area is called the womb. The womb of the man, is what it houses the baby once the baby is formed. So I'm going to talk about the work of each of them, and this part is called the cervix. It's called the cervix. This area is what we call the vagina, and the plus what we call it the vagina area. So let me just leave this one. The vagina area. Then this is the fallopian tube. So we have here the ovaries. We have here the ovary, and this is the ova. So this is, let's just say this is the picture of how the female womb looks like. I might not get the perfect picture, but I just want to do a description of how fertility takes place in a woman. So this area, the sperm, once there's ejaculation, sperm comes in through the V area. It comes in, and like over almost 25 million of sperm comes in through here, and it passes through the cervix area. And they rush towards the egg. This is the egg, the ova, where the ova is. The ovaries house the eggs. So these are the eggs for female. So this is the fallopian tube. So once there's ejaculation, and the sperm rushes down to fertilize the egg. During ovulation, at maturing, once the egg is mature, by the help of the release of some of the hormones that enhances the egg to be mature, the egg will be released during ovulation, and it travels down here through the help of another hormone. We're going to talk about that hormone later. So the mature egg stays here. And the fastest sperm gets here to fertilize the mature egg. It fertilizes the mature egg, and once the egg is matured, it fertilizes and forms what we call gametes. And once it forms the gamete, they travel down back to implant on the wall of the uterus, and that's when you say there's implantation, and the baby begins to grow in the uterus, and the uterus begins to expand through the help of another hormone. So once all these things are in place, as in the sperm is healthy, the sperm is fast, the sperm is okay, it's active enough to travel fast. The fastest one and the healthiest one fertilizes the egg. There's fertilization, and down now there's implantation, and the baby begins to grow here. Once all these conditions are met, everything is okay. The egg is mature enough, the egg is healthy, there's release of egg here, there's fertilization here, there's implantation. Once all these things are in perfect shape, that means there's everything, all these factors here are, they enhances fertilization for a woman. And there's some other things that we can't see here, that we can't draw here, which are the hormones that also enhances fertilization of a woman. Once all those hormones are in place, the hormones that help, there's a hormone that helps the ovary, the egg, to mature. There's a hormone that helps to mature. There's a hormone that transfers it to this place. There's a hormone that helps it to implant, and there's a hormone that helps baby to grow in the uterus. Once all those things are in place, then there can be fertilization. But in a situation whereby maybe some of these factors are not okay, maybe from the male factor. If the male the sperm is not healthy enough to transfer through the cervix to get fertilization. Once the sperm is not okay, or perhaps the area of the vagina, I posted something about the V area, that the pH of the V area can also affect fertilization. I talked about that the V area of the P area can affect fertilization. I'm going to talk about that later, but I'm just trying to show you the picture of how fertilization takes place naturally. So once all these things are in good shape, fertilization can happen. It can take place on normal condition. Once all this now, the hormones are okay, the uterus are okay, there's no scarring of the fallopian tube, the eggs are okay, fertilization takes place. But in a situation whereby these things are not okay, maybe there is a problem somewhere, maybe the pH of the vagina is not okay to accept or to accommodate the sperm, or the cervix is not okay, or there's there are some bodies in the uterus. There's some bodies in the uterus. The uterus is not okay. The eggs are not okay. The fallopian tube is blocked. All the hormones, the ones that we can't even draw, the hormones are not in perfection. Once all these things, there's any problem with this, then either of these could now cause infertility in a woman. So once all these things are put into consideration and you've checked all these things and you discover that, okay, I think this is where the problem is, it helps you to know what you can do per time as a woman who is trying to conceive. I believe you understand that. I'm still going back to the picture later. Okay, so let me continue with it. I'm just trying to explain how fertilization takes place naturally in a woman. So in women, fertility and the ability to carry an infant to term is dependent on several factors. Ovulation, that is the release of the egg to the fallopian tube, the release of a mature egg to the fallopian tube, that's one of the factors. The hormonal system, the hormones that are released from the brain, the hormones that are released, that okay, these are the hormones that enhances the fertilization, the hormones that helps the okay, I think I still continue. The hormones that helps the egg to fertilize, the hormones that moves the egg to where it's going to get fertilized, the hormones that move the fertilized egg down to the uterine wall. Once these things too are not in shape, all these hormones, once they are not there, they could also affect it. Then also genetic factors and other things. So when there's an interruption or disconnect among these factors, an inability to conceive or carry a baby to term is noticed. So now let's talk about common causes of primary and secondary infertility in women, as it has been discussed in previous chapter. So some risk factors causing infertility in women that are worthy of note include: number one, age. Everyone say age. The age of a woman. I won't blame people who say they want to get married on time. Honestly, I won't blame them, because a woman's fertile period starts once the woman gets to puberty stage, 13 upward. Between the ages of 13 and 29, that's the woman's most fertile age. Yes, because I posted, I don't know if I've posted that for every woman, every girl child, every female is born with between 1 to 2 million eggs at birth. 1 to 2 million eggs at birth. For a female that is born at birth, we all have 1 to 2 million eggs. And as the girl child grows, the egg decreases. It decreases as the child grows, as the girl child grows. And once the girl child gets to puberty stage, the egg reduces to like 300,000 eggs once the girl child gets to puberty stage. And for every month that the girl child go through a menstrual cycle, the girl child releases at least one or two eggs, at least 1 or 2 eggs per menstrual cycle. It could be more. So as this girl child ages, the number of eggs reduces. I said 300,000. Once the girl child gets to puberty stage, 300,000 eggs are remaining. So as that girl child grows, the number of eggs remaining in the body reduces. Eggs don't multiply. Yes, you can't increase the number of eggs a female carries. Yes, you can't increase the number. They rather reduce. The eggs reduce per time. For every time the girl has a menstruate, the egg reduces. So once a woman is getting to age of 29, 30, 35, the egg reduce, as in it reduced, the eggs in her body reduce drastically. And that's where they say, okay, the woman is getting out of infertile age. And once the woman gets to 45, that time is the woman is already getting to a premenopausal age. So for every woman that, age is one of the factors that affect fertility. The younger a woman is, the more fertile she is. As once a woman is at fertility age, maybe a fertile period. So the younger she is, the more fertile she is. The older a woman is, the less fertile she is. So that's how age affects conception. So it falls, I said the ability to conceive starts to fall at age 35, around age 35. So once the woman is getting to age 35, the ability to conceive, it reduces. I'm not saying that it's not possible, but the chances reduce because the number of eggs remaining in a body has reduced drastically. And I think that I talked about how you can maintain a healthy egg. The things that can enhance good quality of egg is your egg, the quality of your egg, as in the things you eat, your lifestyle. These are the things that helps your egg to be active, to be healthy. And taking supplements, there are supplements you can take that can help your egg to be healthy, that can improve your egg. And there's something that people do now. They do egg freezing. Once your egg, if you have the ability, if you have the money, is very, very expensive though, but if you have the money, it's also advised that you can freeze your egg when there are still plenty. That is, you have plenty egg, you can freeze your egg. I think maybe it's around, is it 6 million or thereabout? I think I read it on the post, something that's amount of that's what they charge to freeze the egg. So you can freeze the egg till when maybe you do that. Okay, you are not getting married now, or maybe your partner is not coming forth. You can freeze your egg till when you get married. So by that time you can just go back to the egg bank, just tell them that you are ready for a baby, and you still have your baby with your eggs. So it's possible for you to freeze your egg when your egg is still fertile. So another thing that could cause infertility in women is smoking. Lifestyle generally affects infertility in women. Smoking can affect infertility in women. It can affect your egg. It can affect the quality of your egg. It can even affect that of the man. It can affect the sperm quality of the man too. So smoking can affect infertility in women, affects the egg quality. It can affect the DNA of the sperm and of the egg. It can affect your hormonal system. It can affect your body. So it can affect your lungs. So these are the things that can affect your lifestyle. Alcohol, obesity, your weight. If you're on the big side, it can affect your chances. Then your eating disorder too. So this thing can affect your fertility. Lifestyle generally, the kind of lifestyle you live can affect your fertility. And also, if you lack some vitamins in your diet, lack of folic acid, iron, zinc, vitamin B12 in the diet, too much or too little exercise, sexually transmitted disease, exposure to some chemicals such as lead, mental stress, and other lifestyle factors can also contribute to infertility in women. Yes, lifestyle. I talk about lifestyle. When you're exposed to some chemical as lead, mental stress, this can affect the quality of your egg. This is how much delicate your egg are and how much you need to really take care of your egg. There are some things that we do that we feel like, okay, it doesn't really matter. Your weight. This, as a single lady, don't say there are some things that you do and you feel like, okay, it doesn't really matter, but they really matter. Because if you have a lifestyle that is not healthy and you think you are not seeing the symptoms now, it might not really show forth now, but it might still show forth in the future by the time you are trying to have your baby, because it might have affected some things in your system. It might have affected some things in your private, in your reproductive organ, and you wouldn't know the effect of this thing until when you begin to try to have baby. So please, lifestyle is very important. So if you know you have some things that you need to work on now as a single lady, or maybe you've been trying to have baby, you need to work on this thing. Quit smoking, quit alcohol, eat healthy food. As an exercise, mild exercise is still okay for you. Then also medical conditions such as ovulation disorder. Ovulation disorder, this is very, very important. A lot of women have this ovulation disorder. You know, normally every woman is supposed to ovulate. Every woman that is in a fertile age is supposed to ovulate. Every woman is supposed to ovulate. Before, after your menstrual cycle, once the egg has been released, and when there's no fertilization and the egg has been released, 14 days after that, if you have 28 day calendar day, the mature egg is released. The egg is matured. The egg is mature and it is released for fertilization. So the egg is released to the fallopian tube and it is ready for fertilization. So once in a situation whereby the egg is not mature, maybe the hormone that is supposed to the hormone that's supposed to make the egg to be mature is not released from the brain. That is the FHS, the follicle stimulating hormone. If it is not released and the egg is not mature, there's no way there's no way the egg can be fertilized. And there's a situation whereby the hormone that's supposed to send the mature egg to the fallopian tube, if that one too is not released, the egg, there will be accumulation of eggs. So the egg will just be getting mature without being released to the fallopian tubes. And these are the things that could, this accumulation of eggs without releasing, these are the things that causes polycystic ovary syndrome. There are the things that call this PCOS that a lot of people experience that, and they say, okay, I'm not having baby because the egg is getting mature, but they are not being released to the right place. So that's why all these things are very, very important in having a baby. Once there's ovulation disorder in a woman, it can also affect fertility. Because normally, once the hormone is not being released, the hormone that is supposed to do let me just see where I just put those things. Okay. I think I'm trying to see. Okay, I wrote something here. Okay, so the brain is like the driver. It sends signal to which the hormone is released. That is follicle stimulating hormone. So this brain sends signal again to the ovary to tell the ovary that there's need for you that there's need for egg to be mature for fertilization. So after the egg is mature again, another hormone is being sent from the brain. That is the luteinizing hormone that causes the egg to move and reach the middle of the fallopian tube. You see that all these things, they work hand in hand. Once the follicle stimulating hormone has made the egg to be mature, the brain sends another signal that, okay, this egg is mature, is ready for it's like when they say, okay, a woman is ready for marriage. Okay, this woman is ready for marriage. Okay, let's wait for someone to come and ask her a hand in marriage and the likes, and the bride is ready for a man to take her, and the man is not coming forth. That will cause a lot of distress for the woman. Oh, where's my man? When is my man going to pick me? And it causes a lot of challenges, distress, mental stress for the woman. So that is how it is for the egg that is mature and there's no luteinizing hormone released from the brain to transfer the egg to the fallopian tube where it's going to be fertilized. So after that one, if that one is, assuming maybe there's luteinizing hormone that causes the egg to move and reach the middle of the fallopian tube, which we call that one ampulla. That is ampulla is somewhere here. I think in my I don't know if you can see. Yeah, this is where the ampulla is, where the egg meets, the sperm. So once that one is done, once the egg is able to get there, it stays there, and that is when they say the woman is ovulating. You know, most of the time, a lot of women, we have ovulation pain. That is when the egg is moving from the ovary into the ampulla, where it's waiting to be fertilized. And when there's no fertilization, that is when the egg now goes down into the uterus, and they say the woman is releasing she releases the egg as a menstrual period. But in a situation whereby the egg get fertilized at the ampulla, that's where fertilization takes place. So while you're having sexual intercourse, so sperm move to the ampulla to fertilize the egg, and the baby form at the ampulla and move back to the uterus. So once the baby forms here at the ampulla here, once the sperm is able to get here, once the sperm is able to get here, this is the egg, and I drew it here. Once the sperm is able to get there, it fertilizes it, and it moves down to the uterus wall to get implants there. So in a situation whereby a woman has ovary abnormality, as in ovulation abnormality, maybe the woman is not ovulating, or eggs are not being released, or different things, this could cause infertility in a female. Also, hyperprolactinemia. Hyperprolactinemia, that is release of too much prolactin in the woman's body. You know, prolactin is an hormone that stimulates the milk in the woman's breast. And wow, this thing, when I heard this thing first, I was like, why now? But this is something a lot of men, a lot of husbands likes, fondle their women's breast and the likes. And why is it something that could affect someone that is trying for a baby? You know, during pre-intimacy, most men fondle the breasts to stimulate sexual arousal, so this shouldn't ordinarily result in infertility. However, in women with high levels of prolactin, which is a key breastfeeding hormone, this can stimulate milky discharge from the breast. This condition can cause irregular or no ovulation, resulting in infertility. High levels of prolactin in the blood could cause by a pituitary tumor, nipple stimulation, medicine given for depression, psychosis, high blood pressure, excessive stress, or exercise, herbs including fenugreek. Okay, so you know, when this prolactin is being released, you know, once a woman gives birth, the brain sends another signal to the for another hormone to be released, that okay, well, the baby has come. So at that time, every other hormone ceased because they've done their work. Now the prolactin is the hormone that will now stimulate the mammalian gland, they call it, the breast of the mother, to secrete milk so that it can nourish the baby. So in the case of a woman that has high prolactin already in her body, and the man is stimulating the breast, is funding the breast, this can send a signal that to the brain that a baby is trying to force milk out of it. So that's why you see some people that they are not pregnant, but milk is coming out of their breast. So this sends a signal, and it stops. You know, once this sends a signal to the brain that prolactin is being called for from the breast, automatically the brain will know that, okay, I think I need to stop releasing the hormones that makes a woman get pregnant. I think I need to stop releasing the hormones that makes a woman to ovulate, because it is what the signal that is sent to the brain that determines what the brain is going to release, because everything is stage by stage. So it believes that, okay, this gland is being activated. Obviously, we believe that, okay, a baby is already there, a baby needs something. So the brain will send the signal that there's need for prolactin. And once there's release of prolactin, the luteinizing hormone, the follicle stimulating hormone, the estrogen, all those ones, they stopped. They stop because the brain believes that, okay, the baby has arrived. So this is another thing that could cause infertility in some females, some women that have high prolactin in their body. So another factor that could affect infertility in a female is uh, is poor egg quality. Poor egg quality, I talked about that there are some lifestyle that could affect the quality of your egg. So eggs that are damaged or develop genetic abnormalities cannot sustain pregnancy, and it has a risk of infertility. If the egg is not healthy, there's no way the egg can produce a healthy baby. That's why they say some people that if some older women get pregnant, there are high chances that they have abnormal babies, because the eggs are not really okay. The eggs are not healthy enough to produce a healthy baby. So poor egg quality could affect fertility. Once the egg is not healthy, it has been affected by maybe lifestyle, it has been affected by different things, different factors. It might not produce a healthy baby. So another problem is thyroid problem. Okay, I think I need to talk about the. Okay, let me quickly talk about this before I move to this. There are some things I want to talk about. You see, most women, infection is one of the significant impact. It has significant impact on infertility, infection. And the truth is, a lot of women have infection and they don't know. And that's why I said young ladies should even be a part of this. And don't say because you are married, because you are not yet married, that you don't need to really put this into consideration. I treated PID before I got married. I never knew that. Okay, PID is something that it could come through any means, because a woman has different openings in her body. We women, we have different openings in our body, and there are different things. There are different ways that infection could come in, and that's why they say that sometimes if a woman, as a woman, how do you clean up your V area when you pee? How do you clean up? If you clean from back to the front, there are chances that bacteria from your anal area could be transferred into your V area, and that could cause infection. So an untreated, long-term untreated infection could lead to PID, that is pelvic inflammatory disease, which could, those bacteria could transfer to your uterus, to the fallopian tube, and they could cause what we call the scary. They could call, is it scary? They would call the scar, as like a scar on the fallopian tube or the wall of the uterine. So long-term untreated PID could affect the fallopian tube. It could cause a blocked fallopian tube. It could affect the uterus. It could cause all these things. They are often caused by different things. Sometimes it could be STI, sexually transmitted infection. When a woman has infection and you are treating the infection, but your partner is not treating the infection, obviously, in as much as your partner is having intercourse with you, the infection is going to keep coming back. So if you are treating infection as a woman, your husband too needs to treat the infection, so that you know that you are free of that infection, because infection is one of the highest cause of infertility. Infection could affect the quality of your egg. Infection could affect you in different areas. It could cause blocked tubes. It could cause scarring. That's what I was looking for. It can cause scarring and damage of the fallopian tube. And once fallopian tube is damaged, it's just like this. Let me just show you the picture again. Normally the egg is supposed to flow freely through the fallopian tube, and once the fallopian tube is scarred, maybe due to infection, it's like there's bruise of this thing. Instead of the egg to travel freely and smoothly through the fallopian tube, the egg gets stuck here because of the infection. And for each month that an egg or eggs are being released, they get stuck here. So there are many eggs that are stuck here because they are not being released down to the uterus. And there are sometimes that could be scarring even on the uterine wall. There are sometimes that the uterine wall to endometriosis too. That's the thickness of the of the uterine wall. This too it can also cause infertility in a woman. So, talking about infection has a very high risk of infertility in a woman. STI, sexual transmitted infection like bacterial vaginosis, VV, this can cause infertility, and they can impact infertility by affecting the cervical mucus and creating a hostile environment for the sperm. I posted something. Let me just talk about that briefly before, because this is very important. Okay, I think I've talked about the decline in air quality, risk in air quality. Okay, miscarriage risk also increase with age. Okay, yes, when a woman is, we're talking about the age, it increases the chances of miscarriage. Okay, I want to talk about this. Okay, sorry, there's something I was looking for. Talking about, I'm trying to explain the pH of the. Okay, I posted something about pH of the vagina can also cause infertility. Normally, the pH of the vagina is supposed to be between 3 to 3.5, up to 4.5. Yes, that's the pH of the vagina, and the pH of the sperm is between 6.5 to 7.5. So, because sperm survive more in an alkaline environment, but not too high alkaline. If the alkaline level of the sperm area is too high, it could damage the cell. And if it is in a too acidic environment, if it is in a very high acidic environment, it could also kill the sperm cell. So what do we now do? Now the vagina, the pH of the vagina is between 3.5 to 4.5. Yeah, I talked about that. The pH is between 3.5 to 4.5. And once there's ejaculation, the pH of the sperm is between 7.2 to 7.4. And once it reaches the vagina, the vagina is acidic itself. And that's why they also always encourage that, okay, don't use soap to wash your V area, because the soap is alkaline in nature. And by the time you use soap to wash your V area, it can make that vagina area to become alkaline, which could damage the cell in the V area. It could damage the cell, it could cause infection. The V area, it cleanses itself naturally, and that's why they encourage that you use warm water to clean your V area. Because if you use soap that has alkaline, it could affect the concentration, it could cause infection, because the acidic in the V area, it helps to kill the infection. It kills the infection. It does not allow infection to thrive, because the place is very exposed. So once this place is less acidic, it will give room for bacteria to thrive. So the V area needs to remain acidic. So once there's ejaculation and there's release of sperm that travels through the cervix, once it travels through the cervix, the pH increases. So once it gets to the vagina, once it gets to the cervix, it increases to 6.5 to 7.5. And once it gets to the vagina, it becomes 4.5 to 7.5. Now it has gotten to a kind, they call it, like buffer solution, like a place where acid and base meet together. When I saw that word, I remember my chemistry days, that, okay, buffer solution, at a point where the acid and base meet together, when they combine together, trying to form a neutral compound. So at that stage, it is neither the sperm is neither acidic nor alkaline. So it is in a neutral, averagely neutral area, because if it is too acidic, it could kill it could kill the sperm cell. And if it is very, very alkaline, if it's high in alkaline, it could also damage the sperm cell. So once it gets to the V area, which is acidic in nature, it neutralizes it, it balances it together, and it gets to that optimal pH level of around 4.5 to 6.5. So we need to really understand that. So please don't use soap, don't use alkaline substance to clean your V area, because it could kill those cells, it could kill the bacteria that could it could lead to infection in your V area, because that acid it helps to kill all the bacteria that could affect, that could cause infection, that could cause infection in your uterus and in your fallopian tube. And once it reaches the uterus, it gets to around 7 to 7.8. So I think I need to really explain that before I move forward. I think cervical mucus, cervical mucus is what is released during a female ovulation, woman's ovulation, and this one, it enhances the movement of the sperm through the to service to the uterus and the fallopian tube. And this cervical mucus is also between the pH of 7.5, between 7 and 7.5. So maintaining a balanced pH in both the vagina and semen is essential for the semen, for the semen to try, for the semen for the sperm to be able to reach the egg, to penetrate the egg. Okay, so these are the things. So this is why infection is one of the highest things that could cause infertility, because these are things that we don't really take cognizance of. We just do things anyhow. We just, when you have infection and you don't even know that, okay, you really need to really take care of your body as a woman, even before you start trying to have baby, because these are the things that cause blockage of the uterus and affect the uterine wall too. Okay, so let's quickly talk about tests to do. Okay, I think another thing, I talk about problems in the uterus or fallopian tube. So this prevents the egg from traveling from the ovary to the uterus. So if the egg does not travel, it can be harder to conceive naturally. So this can be caused by scar tissue from surgery, submucosal fibroid, endometriosis, or previous sterilization. I talked about that. Once a woman has fibroid, endometriosis, fallopian blockage, these are things that could block the fallopian. So I talk about thyroid hormones, which influences the lining of the uterus and need to be receptive to fertilize the egg. So let's quickly talk about tests to do. So tests for female infertility are aimed at ascertaining if any of the necessary processes involved in pregnancy are impaired. So a standard fertility test will include a general physical examination, including a regular gynecological exam. So the first one is ovulation test. So blood tests measure the hormone levels to determine whether the female is ovulating normally. Blood tests, when before a woman starts waiting, or maybe even before you even begin to start trying to make babies, you need to test your hormonal level, whether you are ovulating or not. So they take your blood sample and they check your hormone level, they check whether you are ovulating, they check the level of your hormone. All these hormones that I mentioned, the FSH, the LH, the prolactin, progesterone, estrogen, these hormones should not be too much and should not be too less in your body. If it is too much, it will affect you, and if it is not enough, there is a normal quantity that you need as a woman to enhance conception. So you need to do your ovulating testing. Then hysterosapinography, let me just call it HSG because I didn't even know the full meaning when I did mine, but I knew that it was called HSG. This is when this evaluate the condition of the uterus and fallopian tubes, and it looks whether there's blockage in your fallopian tubes, and they transfer, they pass a tube through you, and with a fluid they transfer a fluid to your uterus, to the fallopian tubes, to check if there's blockage. And you know, the doctor has already told me that, oh, you are going to feel pain after this, that if you feel pain, then then you are okay. You know, he told me actually that if I really feel pain after a while, that it means I'm okay. But if I don't feel pain, then there's a problem. So that means if I feel pain, that means the fluid is able to pass through the fallopian tube, is able to pass through the ovary and the uterus, through the fallopian tube. You know, it passes through it and come out. But if I don't feel the pain, that means my fallopian tube is blocked. That means the fluid cannot pass through this place. So if a fluid can't pass through this place, oh, I need to charge my phone. 1 minute, please. Yeah. Thank you. Okay, so if the fluid can't pass through this place, if they pass through they inject the fluid and it comes through here, you know, and it passes through to the fallopian tube. If I feel the pain afterwards, according to the doctor, he said if I feel the pain afterwards, that means the fallopian tube is free, is not blocked. But if I don't feel the pain, that means the tube is blocked. So that was one of the tests. I can remember that test because I really felt pain for the test. You know, even though he gave me some pain relief, some drugs, you know, and the likes, he said once I get home, I should just make sure that I lie down. And homo, it was hell. After a while, after I got home, I had to call the doctor and sir, I'm feeling pain, serious pain. And he said, yes, it's better as you feel the pain, that it shows that your fallopian tubes are okay. So these are other tests you can do as a female. It's painful, but it's very important for you to do it so that you can just take all the fears and doubts away. Then ovarian reserve testing. So this test helps you to determine the quantity of the eggs available for ovulation. So this approach often begins with hormonal testing early in the menstrual cycle, you know, before the eggs are released. You know, the hormone that are released, the hormone that makes the egg mature have been released, and it helps you to test the number of eggs that are really mature. So they check the number of eggs that you have per time. I think this is very important for people that want to do IVF. You know, IVF, so it helps them to know the number of the number of eggs they have, the number of eggs that is mature. So this helps you to know when you're ovulating and if your eggs are really mature. And this can help you to, you know, once they know all these things, it will help them to know the kind of hormone that needs to be boosted, whether you don't have enough LH or FSH. So it will help them, once they do this test, they will know what to give you to, as in the hormone that you need to really boost. Then other hormone testing. So the other hormone testing check the level of ovulatory hormones. That's what I talk about, as well as pituitary hormone that control reproductive process. So imaging test. A pelvic ultrasound looks for a uterine or ovarian disease. Sometimes a histogram, also called Sally infusion sonogram, is used to see details inside the uterus. So also hysteroscopy. The doctor may request a hysteroscope to look for uterine disease. During the procedure, a thin lighted device is inserted through the cervix into the uterus to view any potential abnormalities. So I didn't do this one. I did HSG, and I think HSG was the first one I did. It was the first thing I did, and after that, I'm not sure. I can't remember. I didn't do any other test. But okay, I did another test that they discovered that I had ovarian cyst. Yeah, I can't remember the name of the test, but I think it's either this hysteroscopy that I did. They did scan for me. They did one scan for me. They did X-ray for me. They did that for me. So they checked for the ovary, whether my ovary was in good condition, but they discovered that I had ovarian cyst then, and I was scheduled for surgery. I was scheduled for surgery, and I was supposed to come back 2 weeks afterwards. And on getting there, that's why I said my own conception, I can say, it's a miracle, because I can't really say this is what I did, this is what I did right, or this is what I didn't do right. But I was just going through every stages that I was given. I was taking the drugs they gave me, I was taking the vitamins they gave me, I was taking the supplement, I was taking all those things. But I can't really say this is what I did. So when I went back to the doctor, to check for the ovarian cyst, when the doctor did the scan and he did everything, he said he can't find the cyst. And I think I read somewhere that sometimes the cyst disappears itself. I don't know, but the truth is the cyst was not there. It was not found afterwards. So that could be another test to be done. Then laparoscopy. This minimally invasive surgery involves making a small incision beneath the navel and inserting a thin viewing device to examine the state of the fallopian tubes, ovaries, and uterus. A laparoscopy may identify endometriosis, scarring, blockage of irregularities of the fallopian tubes, and problem with the ovaries and uterus. So these are the things too that can help for people with PCOS, to check the level. Maybe if there's a mass there, to check if there's a mass on the fallopian tubes or the uterus, to check for endometriosis. So this test too is also important. So not everyone needs to have all or even many of these tests before the cause of infertility is found. The doctor and the patient will decide which tests are necessary for the specific condition. So that's why I talked about you seeing a doctor, and the doctor will, based on examination and questioning, they will know the test that you need to do per time. But I think one of the major tests that need to be done was that HSG, which is what we check the fallopian tubes, the uterus, to check if it is not blocked or not, because those are the major things that causes infertility. Once the fallopian tube is blocked, or PCOS is blocked due to infection or different things that causes blocked fallopian tubes, maybe PCOS, endometriosis, those are the things that they need to check first, because it is very common causes of infertility in female. So HSG is one. So once, if a doctor recommend HSG for you, I will advise you go for it. You do it. It's expensive and it's painful, but it's worth it, so that it can help you to know what you need to do per time. So this is where I'm going to draw the curtain tonight, because I really spent more than the time. Next week we are going to talk. I think I'm going to end this next week, because the other thing that remains is now the stories of hope. Yes, the story of hope. It's been an insightful journey so far. So I'm going to end it with the fertility treatment, basic fertility treatment options that you need to do as a man and as a woman. We talk about the optional, the alternative, the assisted reproductive technology, things, other means of having a baby. Not everybody will have a baby naturally. Some people might need assisted reproductive technology to get their baby. In as much as it's your baby, yes, it's a gift from God to you. So embrace it. There's so many alternative technology to have a baby now, and whichever you choose to use, whichever you decide with your spouse to use, it's all okay for you, in as much as it's your decision and it's what you want to have. If you still want to trust in God for your baby, I know there's nothing that is impossible for God to do. Like I share my testimony that, when we went to the doctor, and the doctor said there's no way we can get pregnant naturally except through IVF. And maybe, perhaps if we had money for IVF, perhaps we would have gone to do the IVF. But when you don't have money, that's when your faith will increase more. We have to just go back to God and just start trusting God, that God will believe that you can do it, and God did it. So you can keep your faith alive. You can trust God for your baby. You can trust God for your conception. Once you know that every other thing are in check, every other thing are in place. Spiritually, you are spiritually sensitive. Physically, you are okay. You are healthy. Your lifestyle is okay. Medically, you have done every necessary test, and everything is okay. Is in tune with your body, with your spouse's body, with your own body. Your reproductive body is okay. Then you've done everything. Then just keep your hope alive and trust God and keep doing what I told you to do. Remember, I mentioned 3 major things that you need to be doing. Number 1, do you remember? Number 1, active sex at least 3 times a week. Number 2, unprotected sex with your spouse. Number 3, doing this for at least a year. Yes, once you are doing this for at least a year, has been handled. Okay, so this is where I'm going to draw the curtain tonight. It's been an amazing time coming here to have this session with you. And if you have any question, you have any contribution, you have any experience, you can drop it in the comment section below, and I'm going to respond to you. Thank you very much, and do have a blessed night. And I pray, I send this word of prayer to you, that the Lord Almighty will remember you. The Lord will give you your own testimony in the name of Jesus. The Lord will give you direction to know what to do, to know where to go, to know even the medical center you need to go part time in the name of Jesus. The Lord will help you to know the decision to make. Maybe there is a lifestyle you need to work on. Maybe there is something you need to do concerning yourself, concerning maybe your body, your mind. Maybe there's something you need to do. God will give you direction. He will open your eyes. Maybe there's a supplement you need to take. God will give you direction in the mighty name of Jesus. Thank you, faithful Father. In Jesus' mighty name, we have prayed. Amen. Thank you, and do have a blessed night.